Hello, this is Dr. Terrance Baker coming to you from NABN-TV with a public health service announcement. As you know, the nation here and around the world, over 30 nations, has been faced with infection from the coronavirus. There's certain things that you and I can do to prevent getting the coronavirus, and if we do get it, things that we need to do to keep our family safe. First, you must begin washing your hands at every opportunity. Anytime that you're out and about, or even in your own home, washing your hands with just plain soap and water. It does not have to be an antiviral soap. Plain soap and water is all that needs to occur, but you need to do it frequently and often anytime you think you may have contacted something where the virus could be living or laying on the surface. Number two is if you feel sick, you need to self-quarantine yourself. That is, if you feel like you have a fever, chills, runny nose, sneezing, coughing, sore throat, chest congestion, any of these type of symptoms, you need to quarantine yourself. Most patients who get the virus will not need to be hospitalized. You will not need to go to the emergency room, and you will not need to go to an urgent care center. Most of you will get an infection that will be mild to moderate and no different than the common cold. The coronavirus, prior to this mutation, caused common cold type symptoms every day. You and I were sick, and in fact, most Americans would sometime in their life have the coronavirus. So if you feel sick, you need to quarantine yourself away from others. If you're in the house with family and children, you need to go to your room and stay there. Have them bring you food and beverages until your illness improves. That we're also in the middle of the influenza season, and many of you will still continue to get influenza A or B. Influenza A or B will start with a high fever, chills, sore throat, cough, cold, body aches, malaise, melasma, and you will feel terrible. Some of you will not need to go to the hospital. Some of you may need to go to the hospital if you feel like you're becoming dehydrated, but influenza is still very common. And if you do have a high fever that doesn't want to break, you develop a cough where you're coughing up sputum, that is spit that's colored, you need to go and get examined by your family doctor, the urgent care center, or the emergency room. I would call ahead and let them know you're coming so that they can take precaution again for other patients. Next is that if you have the opportunity to avoid groups of more than 10 people, you should do so. Many schools, classrooms, universities, conventions, meetings will be canceling in the weeks ahead because anytime you're in a group of more than 10, you're at risk for one or more people within the group of having an illness that can be spread to you. So stay away from groups of people whenever possible. When you do go out shopping for your food and your products that you need to run your family, keep your distance from everyone around you, wash your hands frequently, and remember to keep your distance at least 6 feet away from other shoppers and other individuals who may also be out getting their food and their groceries. Next is that if you see someone that appears sick, you need to leave that person's presence. So if you see someone sick out in the community, cough, cold, runny nose, they seem feverish, sweaty, hot, you need to avoid that person and you need to leave that room or leave that environment and just simply get away from that person who appears sick. So these are common measures that you and I can take that will allow us to get through this challenging season of the novel coronavirus. Also, for treating your symptoms, start with common treatments including Tylenol, fluids, rest, quarantine yourself, Robitussin for cough if necessary. These are simple measures that you can take to begin treating yourself at home and not needing to go to the emergency room or urgent care. Also, I want to invite you to a very exciting program that's coming up very soon. NABN-TV will be featuring a show of experts, medical experts, known as Doctors in the House, which Doctors in the House is a program where specialists and experts in the field of medicine from around the world are going to be coming to talk to you about common medical conditions here and in the African nations. And we'll give you an opportunity to learn about medical conditions that you and or your family may have and what measures and steps you can take to improve your health. So please join me in looking forward to and watching Doctors in the House.
NABN, New Africa Broadcasting Network.